Joining me here in Studio A, as I mentioned, to talk a little bit about Heart Month and how to keep our hearts healthy. Jennifer Cowan is here. She is the physician's assistant, for the San Juan Regional Heart Center. Good morning and welcome to KSJE. Nice to have you here.
Thank you for having me.
You're welcome. Happy Heart Month to you.
And to you as well.
Thank you very much. And so we were talking before we came on the air this morning that heart disease is still the number one killer of Americans, right?
Yeah, it is. Although we're doing a better job of keeping people alive longer.
Thank you.
Oh, yes. But that also just means that there's more people living with it every day.
Right. And so you and your colleagues at the San Juan Regional Heart Center deal with this all the time. And one of, I guess, the contributing factors would be maybe our American lifestyle. Doesn't help, does it?
It sure doesn't. We eat a lot of salt. We eat a lot of sugar. And I think a lot of us like to be slugs.
Right.
So those three things.
I think the preferred term is couch potato, but okay.
Yes. But I think it's hard because Americans keep very busy. They, it's drilled into us from an early age that working is incredibly important, and I think a lot of times that means that we put ourselves, 6th, 7th, 8th, 9th on the list of things that are important.
Right. Our health. And, yeah. Exactly.
And so trying to switch that mindset is hopefully one thing that we can do moving forward is you have to put yourself first, because if you don't, then everything else does suffer.
True. That's very good advice. And so today we're going to be sharing some information for folks, and certainly we want to advise folks to always talk to their primary care physicians and about their personal health and things like that. Don't just take what you hear on the radio and go with it. But there are some things that probably we can all do to start living healthier and helping our heart and things along that line. I guess one would be diet, right? To try to cut down on all that salt and sugar that we eat and digest.
And so I'll get a lot of questions, or I'll talk a lot with my patients about diet. And I could sit here and tell you, well, this is what you should do. This will help make you healthy. But really, the things that we really need to do are things that you can do and that you're willing to do, not for the next week or month or year, but what changes can you make that are sustainable and that make it so you're still happy to get up in the morning.
Right.
And so one of my main recommendations is, most of us learned about the food pyramid.
Yes.
And I don't know what they're teaching now, so I can't say, but the food pyramid really kind of has it wrong. The thing that I like to do is pretend you're looking at a plate, and the first thing to do is just use smaller plates when you eat. So that helps with portion control. We do like to eat in this country, and we like to eat big portions, steaks the size of our head. But try to find plates that are a little smaller, and then half of your plate should be vegetables.
Okay.
That should be the base of your diet, is vegetables. And for the most part, green vegetables are going to be better than the others. But having a very colorful plate is always a nice thing to have. And then a quarter of that plate should be a lean protein, and a quarter should be a grain. Now, most of us go for carbs that are maybe white. They're white. Yeah. White things tend to be not as healthy. White rice, any sort of bread, pastas, all of those things, really get used just as sugar in the body. So the closer we can get to the actual grain itself, the better our body does at processing it and using it more as fuel. Those things also tend to have more protein in them than just carbs.
So give me an example of like a different kind of maybe bread or pasta to have besides the white bread
stuff.
Or pasta, right?
So brown rice, I would say.
Healthier.
Quinoa.
Yes.
The ancient grains, barley, freekeh, things that we don't use a lot in our diets, trying to start experimenting.
Okay.
But if you're going to go for the stuff that's a little bit easier, pastas that are smaller tend to be a little bit better for us. So not the thick noodles, but the really tiny noodles. There are some that are made with multigrains. I don't know that those are going to be a whole lot better, but maybe instead of using a whole big, bowl of spaghetti, you use get a spaghetti squash and maybe half spaghetti squash, half regular spaghetti.
Okay.
So that you're still getting some of the stuff you like, but maybe you're cutting back the portion by half.
Right. Got it.
Yeah.
And probably if you make it, and you might not be able to tell that it's part squash, part spaghetti.
That's right.
Right. And so that's part of this as well. And so, and for the bread part, I keep going back to that, like wheat toast and things like that. Any better than just the white bread, or not really?
I mean, marginally, but I think more so than the type, maybe using the smaller breads.
Okay.
So instead of your piece of bread being 200 or 300 calories, getting one that's a 90-calorie piece and trying to use that in its place. There are some better breads out there, but a lot of those are pretty expensive, and they're sometimes a little dry. And so, like I said, this has to be something that's sustainable, that we can afford. And so a lot of it is portion control and trying to squeeze more vegetables in there.
Got it. Right. And stuff that you want to eat too, I guess, right? As well, if you're going to make these changes. And so that's something that I guess you probably hear too, is that folks say, well, I'd love to eat healthier, but I just can't afford it every meal, or things along that line. And so that is a big reality.
It is, and especially in this area, I have a lot of patients that don't have good access to getting groceries, or they're on a limited income. They don't have good electricity, and so they're forced to use canned goods. In terms of, yes, fresh is going to be the best. Typically, frozen is a little bit better than the canned, but if you have to use canned, you have to use canned. Rinsing things before you use them, that can help, get rid of some of that salt.
Yes.
But also, if you're, let's say, canned beans, potentially, are you able to get the bagged ones that are dry and learn how to incorporate those? Those are typically going to be cheaper as well. Mm-hmm. They're just not as convenient.
Got it.
So some of this is getting... One of my tips, especially with people with a new diagnosis of heart failure, is we give you a lot of information about things you have to change, and it can be overwhelming. So maybe for Heart Month, one of the things people can try is you and your spouse can find a healthy heart diet or a cookbook.
Right.
And make a date night where once a week you guys get together and you find a new recipe with things that you haven't used before, and you try to change. Most of our diets come from our parents, come from our grandparents. And so how do we change that thinking? How do we incorporate new foods? And so making it more of an exploration and date night kind of thing can potentially help change your habits, so you can teach your kids to have a more wide variety and get rid of some of the habits that we've had.
I like that. And starting maybe with once a week, and maybe that turns into twice a week or 3 times a week, and you find meals maybe that you suddenly like, and they taste pretty good, and that becomes part of the regular menu for the family, I guess, right, is what you're hoping.
That's what I'm hoping. And also making more than just one meal's worth, especially if you're doing healthy cooking, because one of the issues is you get home from a long day and you don't want to cook. I know I don't. And so on the weekend, when I have a little bit more time, spending that time making a few meals for the week that you either put in the fridge or the freezer, so that when you're tired, you don't go for the chips or go out to eat. Instead, you choose something that you've already prepared, and it makes it a little bit easier to set yourself up.
Right. Exactly. Very good advice. And so that's the meal side of it and the food side of it. The other part would be, I guess, the exercise and the movement part of this as well, right? Yep. And part of being healthy and heart health is exercise and moving and giving our heart a bit of a workout from time to time, right? That's
right. And almost everyone, right? If you're concerned about something that's going on, talk to a doctor first.
Of course.
But in general, the kind of minimum recommendations is some sort of aerobic activity for about 30 minutes a day. And
does it have to be 30 continuous minutes?
Now, that's best.
Okay.
But if you can't do it all at once, I'd rather you do 5 minutes here and there than say, oh, I can't do it today.
At all, right.
And so one of the easiest things is, right now it's a little hard because it's colder outside, but a lot of times by the end of the day you're tired and you don't want to do those things. So the first thing in the morning before you do anything else is go out for a walk, or do some body weight exercises. wake yourself up to it and just try to get it done early on. And if you can't, moving more during your day, instead of taking the elevator, huff and puff through the stairs. Walk across the street instead of driving. Just little things here and there to increase that movement.
Right. Should I park an aisle away from my office door, or 2 or 3, or get right up in front of the office?
Well, it would be great to park in the way back, but I know that's just not always possible. So if you have to park in the very front, maybe you walk a few hallways and stay warm.
Yeah.
Yes.
Makes sense. If I'm going to the mall, should I, again, park a little bit further out, maybe?
And the mall is actually a great place to get some steps in.
Indoors.
Yeah.
Use their heat.
Use their heat, window shop, or if you're at home, there's so many things on YouTube where you can look for, if you're in a wheelchair or if you're using a walker or you're very limited, there's a lot of resources out there to find little workouts that you can do just from your chair.
Good point.
And just with things around you, maybe a book where you're lifting it over your head, or you're standing up from your chair 10 times throughout the day,
right,
so that you're using those muscles when you can.
Right.
And so I think YouTube's a great resource too.
That is a great resource. And again, we are advising folks, certainly check with your personal physician and your primary care physician.
I call them your quarterback.
Yeah.
Yeah,
right.
they're the person who should almost know you better than you know yourself.
Right.
And so any changes, they can help direct and make sure that you're on the right track, or get you to a specialist if you need it.
Exactly. They know your history. They know what you're capable of doing, I think, and maybe can encourage you to do some of those things. So that's really important. So diet and exercise. Seems like we hear that all the time, right, about these things. But is there some, I guess, benefit? There has to be benefits, obviously, to doing these things with our heart. If our heart is weak or in some kind of a condition, could it actually improve by doing some of these things, even if we're older? Definitely.
If you think about just any muscle in the body, if you were to start lifting, let's say when you were in your 20s, you were lifting, or you were in a sport, and you remember that muscle tone you had. Your heart and your lungs, they're also muscles. And if you don't use them, you start to lose. But that doesn't mean you can't get it back. Just like if you were going to start lifting your biceps again, you'll get muscles again.
Right.
So you want to use those things because you want them to be stronger.
Sure.
And so little steps, starting slow, making sure. And then once you get to, let's say, 30 minutes a day, one of the great things about being active daily is you give yourself a little stress test every day, so that if in 6 months from now you start feeling different, you start, man, I used to be able to walk 2 miles and now I'm getting a half mile and I am just burnt. Then you call your doctor and you say, something's changed. I don't know what it is, but we can then start to investigate, because you've been a good advocate for yourself and you kind of know what your baseline is. If you're just sitting on the couch, you might not notice that. You might start feeling worse and worse, but you don't know, because you haven't been that active, how big of a difference it is.
Got it. And what could that mean? I guess, is there any? I know every case is different, but if someone used to be pretty active and then now all of a sudden they're getting winded after one flight of stairs or whatever the case may be, is there anything tells you what's going on?
It can certainly be related to your heart. There's a lot of different things that affect your heart. Coronary artery disease, which is a plaque and hardening of the arteries of the heart. When you have blockages, that can cause you to feel chest pain, but also just fatigue, shortness of breath. And then heart failure. Heart failure, there's dozens of different reasons that people have heart failure. Some we can help, with your blood pressure, diabetes, coronary artery disease. But with heart failure, those can be symptoms of that as well. And I don't want to freak anyone out, because also the common cold can cause that.
Right.
There are a lot of different things that can cause you to feel bad, but being aware of how your body feels is, you're the person that's living in it every day. So don't ignore it. you want to talk to someone about it to make sure we get testing if we need to, and just keep an eye on you if you're feeling bad.
Sure, and that's a great segue into heart attacks and things like that, because I think a lot of people maybe sometimes feel, well, I've got this little bit of chest pain. Maybe it's what I had for lunch, or maybe it's indigestion, and they ignore it. And sometimes they ignore it at their peril, because if it's an actual heart situation or heart attack, time is muscle, as I have heard from folks in your line of work.
That's exactly right. So chest pain is you have to parse through chest pain to figure out if it is coming from your heart or other places. Sometimes we can do that by questions. You know, if you push on it and it hurts, usually you can't push on your heart.
Yeah.
So a lot of times that's just from muscle. But if you're having chest pain, especially if the chest pain happens every time you're active, or you have some nausea, some shortness of breath, other symptoms, you want to talk to your doctor, or if it's significant, you want to go to the ER, because, like you said, time is muscle. So the longer your heart goes, if you're having a heart attack and there's a blockage, if we're able to go in there, not me personally, the doctors,
right,
are able to go in there and open up that blockage, we can help your heart from having permanent damage. But if you ignore it, and then you have this chest pain for hours, when you go in, we might be able to open up that area, but even once we open up the area, if it's been too long, that heart muscle, the cells there have died. And so it doesn't mean that you won't survive. It
right.
just means that now your heart might always have this damage that, had we been a little more proactive, we could have avoided.
Sure, got it. And so with that damage, though, that just means that maybe I'm still tired or fatigued or whatever, and maybe at a higher risk for other things to happen too.
Yes.
And so there's that we're talking about. And so we always hear too sometimes about maybe a feeling tingling in our arm or things along that line. Is that still another warning sign, I guess, of something that could be wrong?
I mean, certainly we get worried about chest pain that radiates. A lot of times they'll say that women have atypical symptoms. If you're one of my patients, you know that I dislike that, because a whole gender can't have atypical symptoms.
Okay.
But radiation.
And we don't always think of women having heart attacks and heart disease and things like that.
And they certainly do.
Right.
But so chest pain, especially chest pain that radiates down the left arm, to the left side of the neck, and to the back, but that doesn't always follow. There are atypical symptoms. Women often have chest pain that goes to the back. But if you're having chest pain that radiates to both shoulders or your right side, that doesn't mean you're in the clear. Now, just a tingling in the arm, if you have neck issues, it might be from that.
Right.
But you just don't want to ignore, especially new symptoms.
Sure.
And it sounds like you're pretty well educated, so are you going to go back to school and join us?
Well, no, probably not. But thank you for thinking that I could. But I've been talking to cardiologists for a long time about these issues, right? And so I think it's an important thing. And I'm kind of sad that we only talk about it in February during Heart Month, but it's because it's something we should be thinking about year-round, obviously, right? But at least we're getting some focus on it for the next 28 days. And so that's important as well. But with your colleagues and the staff there at the San Juan Regional Heart Center, they are able to do a lot of procedures and a lot of things when people present with heart trouble, heart problems, and things like that. What are some of the things that you and your colleagues deal with, I guess, on a majority basis, I guess? What are most people presenting with?
And so, if you're having acute chest pain, or we're worried that you're having a heart attack, we can take you to our cath lab. We have a mix of both interventional and non-interventional cardiologists on our team. And we also currently have one electrophysiologist. So in cardiology, we call them the plumbers and the electricians.
Okay.
The majority of cardiologists are plumbers. And they're dealing with, the coronary artery disease, mainly the heart failure, those sorts of things. But then we have the electrophysiologists that deal with the electricity of the heart, things like AFib. But if you were to come in and we're worried about a heart attack, In our cath lab, we can do a cardiac catheterization and angiogram to look and see if you have any blockages. And if you do have a blockage, we have interventionalists, and it's almost 100% of the time. Every once in a while, because we're in a smaller community, we may not have an interventionalist on where you would have to be flown out, but 99% of the time we can do the intervention right here. Now, if they get into your heart and you have really significant disease in one or multiple vessels, and you need something like a coronary artery bypass, that is done in Albuquerque. Additionally, if you have any significant valve issues where you would need a valve replaced in the heart, there's 4 valves in the heart, that's also something that we would refer down to Albuquerque. If it needs to be dealt with immediately, then we'll send you on a plane and a transfer. A lot of things it's important that you get fast follow-up, but maybe not urgent to do it today.
Right.
So we have a lot of good relationships with the doctors in Albuquerque. Sometimes we'll send people to Denver or to Utah also.
Sure. And I'm sure that just depends on what's going on in those locations, at those facilities, and things along that line. But I guess the most common issue would be the blockages that you're able to deal with on a pretty regular basis. Is that kind of what the bread and butter, pardon the expression, would be at the center?
And we, even though we are a smaller hospital, we service a pretty big area, and so our doctors have a lot of experience. That and maybe it's just because I work with them, but I think we have a really great group of cardiologists in this area. I'm very impressed. As a student, we get to see a lot of different hospitals and be exposed to a lot of different places. And I'm new to Farmington. Moving to Farmington, a smaller hospital, a smaller community, I wasn't sure, and I've been really blown away by the quality of the doctors here.
Sure. Well, and this area is unique, as you and I talked about too before we came on the air, about drawing in patients from a wide area from around Farmington, and so we are the place to go for health care and heart health and things along that line. And so you are bringing in folks who maybe are traveling or living 100 miles away from the hospital, which is very rare, I think, in most bigger hospitals.
It is very rare, and also just because a big part of our patient population doesn't have easy access, and so it makes this unique where we have a way to provide for some patients that you have to find unique solutions sometimes to make sure that you try to get them the best care that they can get, because they might not have a ride, and they might be 100 miles away and not have electricity, not have heat. And so it's a very interesting and fulfilling place to work because you feel like you're actually helping.
Right. Yeah. And that's the other side of it too that I want to ask you about is with your patients, right? It's someone coming in and they're tired and they're maybe in heart failure or having some issues, and they go through these procedures, and all of a sudden they have more energy and they can play with the grandkids longer and go up the stairs and things like that. It is truly life-changing, I would think, in some of these cases.
I mean, it's awesome to go to work and have a patient that's feeling better. I think in positions like orthopedics, you often get to fix your patients, so now they're active again. With the heart, it's a little bit different because our patients tend to be older and a little bit sicker. But if the patients buy in to the plan and are as committed as hopefully we are to getting them better, a lot of times they can't believe how much better they feel. They feel better than they did 10 years ago. And so that's it. It makes it worth it for sure.
I would think so. And great to have them see it as well, because I would imagine that the degradation happened very slowly over time, and maybe they don't realize how much their lives have been impacted by these conditions until they're corrected or reversed, or at least on the road to recovery.
And a lot of times people don't realize some of the things that they're doing that are really detrimental. And salt is just one of the biggest things. We consume a lot of salt in our diet, and sometimes with people just cutting back on salt, they can they'll lose dozens of pounds,
Okay.
depending on how big you are to start with.
Yeah, sure.
But they can start breathing easier, moving easier, and it's something that they didn't realize that they were doing,
Right.
or they didn't realize how much it was impacting them.
Sure.
So yeah, it's just it's helping educate, and then they, hopefully end up feeling better at the end of the day.
I would think so. Well, and things like weight loss is a big changer for a lot of things, right? I mean, it can help your heart, I would think, because it's not having to pump through all that stuff. And then your joints and other things and your lungs, and it's not battling all that extra weight and things, and your knees aren't carrying it around and trying to bend with it and all of those things. So there's multiple improvements, I would guess, right, if you do lose some weight, if you are overweight.
And in addition with weight, it can just increase the inflammation throughout the body.
Yeah.
And so it's doing things that you don't even realize on a cellular level. And we have a great bariatrics community. We do a lot of referrals to our bariatrics center now. They've worked really hard the last few years in building it up.
They've been guests on this program talking about the work that they do. So yes,
yeah, so
familiar with it.
And so it's been a really good addition, because there's only so much time you have to try to help a patient. And so it's another big piece of that pie, because if they can lose weight, a lot of times they get to come off a lot of the medications. Right. Maybe not all of them, but often their blood pressure improves, their diabetes improve, and it just is a trickle-down effect. So
true. Very important. And so you mentioned that many of your patients are older. Would you say, again, not for everybody, check with your primary care physician, but is it ever too late to start doing some of these things we've been talking about today? The diet, the less salt, the walking more, and things like that, if you're able to do it?
I will say it's a unique situation, but I have a hard time telling my 95 and aboves to change their diet.
Okay.
But if they've made it to 95, they probably have some decent genes, but they're also probably doing something right.
Right.
But other than that,
okay.
Besides, if you get to 95, I might give you a free pass on the chips.
Okay.
But other than that, I think that we can all do a little bit better. And it does, like I said, it doesn't have to be, and I don't want it to be big changes. I want it to be small changes that you can sustain and add on.
Right. Got it. And maybe share with your family and.
Yeah, and do it with your family.
Right. We just have a couple of minutes remaining this morning. Jennifer Cowan is my guest. She's a physician's assistant with San Juan Regional Heart Center. Let me talk to you about younger patients, too, because I know the majority is older, you said, but I think, are we not seeing more heart problems in younger people, even children these days?
I don't know I don't know if it's more.
Okay.
I think we're better at catching things.
Okay.
I think
certainly can suffer from heart problems at a younger age.
Yes.
Okay.
And I think one of the cool things we have available now is if you have familial things going on. So, you had a grandfather and a brother, and we have a better chance of catching things when you're younger now than we did prior. So, and we can start you on medications now. So like, there's familial hypertriglyceridemia, so high triglycerides, but it's nothing, potentially some dietary, but mainly it's genetic. We can start treating that so you avoid issues when you're in your 20s, as opposed to waiting when you're in your 40s and you have a heart attack because you have tons of cholesterol in your arteries.
You can catch it and hopefully avoid that.
Yeah.
Got it.
And, we see a lot of patients that they're catching more things because they're wearing wearable devices.
Sure.
They're just, potentially people are becoming more in tune with what's going on. I don't know that that's always true, but I do like the wearable devices.
The trackers, the things like that, tell me how many steps I did, or heart rate, all that stuff.
And some of them will even tell you if you're concerned, if you have a strong family history of atrial fibrillation, or you've had a stroke in the past, but we haven't found anything. Sometimes the watches can catch atrial fibrillation before we can. And so I think there's definitely a place for that.
And that, just to be clear, that's your heart rhythm and the heartbeat, right, is what we're talking about. Not the heart, and some of these trackers can catch that if it's off offbeat or whatever.
Exactly. And so if somebody has atrial fibrillation, they can be at an increased risk of having a stroke. And so we want to catch that. We want to know if that's happening so we can try to, there's a lot of things that can increase your risk of having it, such as untreated sleep apnea, being overweight. There's some things that we can try to change. But it's good to know because it can increase your risk of having a stroke, which can be really life-changing.
Yes, very much so. Very true. Well, good information today as we look at Heart Month as it is here in February, and there's a lot of things I know the hospital does to commemorate and celebrate healthy hearts, including having you come here and talk to all of us about how to make our hearts healthier. So thank you for being here today.
Well, thank you for having me, and happy Heart Month.
Same to you. Thanks for being here. Jennifer Cowan, physician's assistant from the San Juan Regional Heart Center, my guest here on KSJE.